Hello everyone, I'm Marife Carumba and I will going to perform the parenteral medication. So first, check the doctor's order, check the medication administration record MAR, check the label on the medication carefully against the EMAR to make sure that the correct medication is being prepared. Follow the 3 checks of administrating medication. Read the label of the medication when it is take from the medication card. Second, before withdrawing the medication, and after the withdrawing the medication, and organize the equipment. So now let's check the doctor's order to make sure that the patient is right and the medication is right. And also check the MAR, the label, and follow the checks of the administrative medication. And now organize it. The next is preparing the medication from vials. So perform hand hygiene and other appropriate infection to prevention the procedure. So I have an alcohol in here and I will going to apply it, and also to prevent the microorganism. Now prepares the medication of vial for drug withdrawal and mix the solution if necessary by rotating the vial between the palm and hand, not by shaking. Remove the protective cap, and to clean the rubber cap of previously opened the vial with a wipe by rubbing in circular motion. So now let's going to open it, and the vial is now already open. I'm going to rub it by the with aspecific rubbing and circular motion. Like we're going to circular motion for only 30 seconds. Now the vial is good. Attach the filter needle as agency practice detected to draw the up removal and medication from the multi-dose vials. So now here, ensure that the needle is firmly attached to the syringe. Now let's going to attach now. Remove the cap of the needle, then draw up into the syringe the amount of the air equal to the medication to be withdrawn. Carefully, the needle is into the upright vial, to the center to the rubber cup, so maintaining the sterility of the needle. Okay, now the needle is here. Inject air into weight, keeping the vial to the base level needle above the surface of medication. So withdraw the prescriptive amount of the using either the following methods. Hold the vials down with the base over the lower top and move the needle to the what is below is the fluid level in the withdrawal medication. And now invert the medication. Ensure the needle is tipped to the below the fluid level and gradually withdraw the medication. If now there is a bubble, let's tip it. Now withdraw it. If there's a bubble, just take it and insert the cap of the needle. Next is we're going to perform the intradermal administration. So explain to the client the procedure. The medication will produce the small wheel, sometimes called a bleb. A wheel is a small raised area like a blister. The client will feel the prick as needle enter the skin. Provide the client's privacy and select the clean site. After the select and clean site, The forearm hand above the wrist is 3/4 to finger 2 to below. Avoid using side of tender or swollen those that have lesions, and applies gloves indicate the agency policy. Cleans the skin to using the firm circulation motion. So now let's prepare the syringe of injection. Prepare the needle cup and waiting for the inspecting to dry. So now we're going to change the size. What's the real size of the needle? And apply the clean gloves. Now it's already now the preparation is already prepared. Now let's go to the patient and I'm going to explain the procedure. So let's pretend that in front of me is there is a patient in front of me. So hello po, I'm Marife Carumba, nursing student from the Doctor's College. So I'm going to perform the endodermal for you po, ma'am. So before that, now the preparation is already prepared. Let's go to the patient and after now the equipment is already prepared. Let's go to the patient and enter it. So now first is again check the doctor's order and check the patient if it's a right patient and also right medication. So ma'am, I'm Marife Carumba, nursing student from the Doctor's College. May I know your full name, ma'am? Can I see your wristband? So ma'am, unsay prefer nimo nga language, ma'am? Bisaya, Tagalog, or English? So mas prefer nimo ang Bisaya, ma'am. So kani mga procedure na to, ma'am, is mag-inject ko sa imuha to skin test and atong i-check if naa ba siya ay allergy ba ka ani. Kung allergy ka, ma'am, di na to i-apply ang kaning tambal para sa imuha. So okay lang ba, ma'am? Okay po. So removes the needle waiting to inspect to dry, and also expel the bubbles to strain small plugger the consequence and grabs the syringe into dominant hand to rub the holding behind the thumb of the forefinger and needle almost parallel skin surface to the needle up. So now let's going to inject the fluid to the patient with the non-dominant hand. Pull the skin side to, so here let's pull the skin side, and using the ventral forearm grabs the client to forearm and gently pull the lateral ventral skin. Now let's insert the tip of the needle to inject the medication carefully and slowly so that I proceed if the procedure is small wheel on the skin. Inject ko, ma'am. Now stabilize the syringe and needle. Stabilize the needle and inject the medication carefully and slowly to produce the small wheel on the skin. So now withdraw the needle quickly to the skin and angle with the inserted and when the safety device applies to the badge and indicated. So we already quickly withdraw the needle. So now let's going to teach the patient and let's say it, please ma'am, do not massage the kung asa na to i-inject ang katong needle sa imuha, ma'am, para makita na to if allergy ba ka ato. And now remove the discarded gloves and perform high hygiene and inject the encircle the ink to the observed to the integration hardening per urgency. So ma'am, encircle na nako tong asa na og inject mama para makita nato kung allergy ba ka or dili. So documents all the relevant information, record the material given and the dosage route. Evaluate the condition for the offsites of 30 minutes depending on the test. Measure the area of redness and ensure eliminate enlarge the diameter and document finding. Documents if the client has positive or negative skin test result. Follow agency protocol on labeling of the allergies. So ma'am, salamat kaayo ma'am ha. Salamat kayo sa pag cooperate sa atong procedure. So first, check the doctor's order. Check the medication administrator record or MAR. Check the level on the medication carefully against the MAR to that the correct medication is being prepared. Follow the 3 checks of medication. Read the medication. First is from the medication cart. 2 is before withdrawing the medication. 3 after the withdrawing the medication. 4 is organize the equipment. So now let's check the doctor's order. So we can ensure that it's the right patient and right medication, and also the MAR. Now we're going to preparing medication from ampules. First is perform hand hygiene and observe the appropriate infection prevention procedure. Prepare to the medication ampule for the drug withdrawal. Flex the upper stem of ampule several times with the fingernail. So now I have this alcohol, and I'm going to apply it to prevent the microorganism. Now use an ampule opener to piece off the sterile goods. So alcohol wipe between your thumb and ampule neck up or around the ampule neck and break it to the bending toward to away from yourself and from others. So now this is the ampule. So I will going to break it, and let's pretend it that it's already break, and I'll going use this sterile water. So place the antiseptic wipe over the top of the ampule and breaking of the top and dispose to the top of the ampule and sharp container. So now let's pretend that the ampule is already break, and I'm going to disregard it. Now withdraw the medication. Place the ampule to the flat surface here and attach the filter needles to the syringe and to the remove the cap of the filter of the needle and insert the needle to the center of the ampule. Do not rim off the ampule with the needle or tip or shaft. So with a single dose, ampule holds the ampule slightly and necessary to more order amount of the medication. Now I'm going to inject it and dispose the filter of the needle and placing the shaft of the container. If giving the injection replace, the filter is needle with a regular needle and tighten cap to the top of the needle and push it to the needle to the prescribed amount. If there's a bubble, just a tip. Now release it and put the cap. Now next is we're going to intramuscular injection. Check the MAR. Check the level of medication carefully for the MAR to make sure that the correct medication is being taken, and follow the 3 charts of the medication. Read the label of the medication when it's taken from the medication. 2 is before withdrawing and after. And the last is after the withdrawing and medication. So again, organize the equipment. Next is perform hand hygiene and other appropriate infection to prevention procedure. So here I have an alcohol, and let's apply it to prevent the microorganism. And now prepare the medication from the ampule or vial for the drug withdrawal. So this is we use to the ampule, the vial. Now the ampule. Now we're going to exchange it to another size, another syringe in the real size, and to the still sterile needle. So now, prepares to the client, and also prior performing the procedure, introduce self and verify the client identity using the agency protocol. Assist the client to supine lateral position or sitting position, depending on the choosing of the site of the target muscle in the gluteus medius, and have the client to supine position from the lateral position and flex the upper leg and prone position too. So let's pretend that I have patient in front of me. So I'm going to introduce myself. Hello, ma'am. I'm Marife Carumba, nursing student from Double Doctors College. So for today, ma'am, I'm going to inject you intradermal, and this is for I'm going to inject you, and what position would you like? Sitting position, or okay, you're going to supine. So now, obtain the assistant and uncooperative client. Explain the purpose of the medication, so and how it will help using the target language the client understand, include relevant information about the effect of medication. So ma'am, usay prefer nimong language, English, Tagalog, Bisaya. Kaya para ma-explain ako tarong atong procedure today. So ma'am, gusto kang Bisaya. This medication is for your vaccine. Kung guro ka ma'am, para asani. So select, locate, and cleanses the site. Select the site, friends, clean lesion, and turn the swelling hardness. So localize the inflammation, and one has been used frequently. If injection are to be frequent, alternate site, avoid to the same site twice in now. Locate the exact site and inject. And also apply clean gloves. So now I've already applied the clean gloves, and now we're going to clean the site of anti-stick swab using the circular motion. Now, transfer and hold the swab between the third and fourth fingers, non-dominant hand readiness for needle withdrawal position, and client above the needle site. So now prepare the syringe for injection. So here, and remove the needle cover and discard containing the needle. If using pre-until dose medication, take the caution avoid from the prior injection to occur the wipe and medication of the needle sterile gauze. So using the if using the prelive and caution, avoid the dripping medication to needle prior to inject the occur wipe and medication needle. So inject the medication by the Z-track technique, and use the side of the dominant hand, and use the ulnar side of the non-dominant hand, and absorb approximately 2.5 cm or 1 inch. Use the side under the some circumference and such of the emaciated client or an infant muscle and fringe. And now holding the syringe between the thumb and fingers as holding like pen, like this. And piece the skin smoothly at the angle of 90. Hold the barrel syringe and steady to your non-dominant hand, and spite of that, the plunger and dominant is aspire for 5 to 10 seconds. If the blood appears the syringe, withdraw the needle, discard the syringe, and prepare a new injection. And if does not appear, Inject the medication and steadily, slowly, approximately 10 while holding the syringe and steady ventricular site. After injection, wait 10 seconds of using ventricular site. And now withdraw the needle to smoothly same injection and applies the gently side of dry sponge. And not necessary to massage the position side. So now let's go into inject and see side, and now advocate the needle and discard the uncapped needle to the attach the syringe and receptacle. Remove that and discard the gloves and perform hand hygiene and dominant relevant and time administration, drug name and route for the client reaction. So now perform the hand hygiene. And assess the effectiveness medication at the time of expecting to act. So first, check the doctor's order. Check the medication administration record like MAR. Check the level of the medication carefully against the MAR to make sure that the medicine is being prepared. Follows the 3 and 4 administering medication. Read the label on medication when it's taken from the medication cart. 2, before withdrawing the medication and after the medication. Organize the equipment. And now perform hand hygiene and observe the appropriate infection prevention procedure. So now I have here alcohol, and I'm going to alcohol my hand and to prevent the microorganism. So provide for the client privacy. So let's pretend that the place is now closed. Prepare the client, and prior to performing the procedure, introduce yourself and verify the client's identity using the agency protocol. So hello ma'am, I'm Marife Carumba, nursing student from Davao Doctor College. May I know your full name, ma'am? Can I see your wristband? Okay. Now, assist the client to position in which the arm, leg, or abdomen can be relaxed depending on the side to be used. And abstain the assistant to holding an uncooperate client. Explain the purpose of the medication and how it will help using the language that the client can understand, and includes relevant information about effect the medication. So ma'am, can I ask you, unsay prefer nimo nga language? It's either English, Bisaya, or Tagalog. So ma'am, Tagalog. Ay, Bisaya po? Bisaya po ba? Bisaya ma'am? Okay. So ma'am, kay Bisaya man ang muhang prefer ma'am. So ang button ma'am is subcutaneous injection. And this, kani siya ma'am kay, pag kung medication sa imuha using this under your skin, ito type siya needle to you inject. So para asa din ni siya ma'am? Para ni siya sa imuhang body for all your tissues, and kani siya ma'am is for your insulin or kanang diabetic po kanan. So now select and clean the site. Ma'am, din ako ma'am ha. Select the free tenderness, hardness, and swelling, scarring, itching, and burning, or to localize the site of that has been used frequently. Applies clean gloves. Now I already applied the clean gloves and agency to protocol to indicate the clean site of the and speak swab and start the center of the set and clean in the widening circle to the 5 cm in or 2 inch. Allow the area to dry thoroughly. So place and hold the swab between the third and fourth fingers to dominant hand to position on the client internal side. Prepare the syringe for injection. And now remove the needle cap. But for now, going to use another needle to sure the size. Now inject the medication to graft the syringe to dominant dominant hand and between the thumb to the finger to the thumb side of upward of 45 angle insertion and palms downward to the 90 angle insertion, and prepare to inject using the non-dominant hand and pinch the spread of the skin and the needle using the dominant hand and firm steady to push. Now I'm going to insert ko ma'am. And now inject the medication by the holding syringe and steady and depressing the vulgar slow even pressure. And now let's push it. Remove the needle. And get the cap. Remove the needle smoothly and along the insertion, depressing the skin by the non-dominant hand and bleeding occur, apply the pressure to site dry sterile gauze until it stops. Dispose to supply appropriate. Assist the patient to comfortable position and flip down the medication ticket using the MER. So ma'am, pag ano ka ma'am, kung sa'yo position na yung gusto ma'am. Okay. So let's pretend the patient is now what her comfortable position and do declare removes the gloves, dispose use item appropriate and waste acceptable return to the equipment and perform hand hygiene. Assist the effectiveness to medication time and expected to act. Document all relevant information. That's all. Thank you.